So we're going to talk a little bit about holistic and biological dentistry today. A lot of times when I talk about holistic dentistry, the first question that people ask is, how is it different than traditional dentistry? What is it that you're doing that makes it that much different? What we do is we use alternative therapies in the dental work that we do. So we use homeopathic remedies, supplementation, aromatherapy, and a host of other alternative therapies to augment the dental work that we do. We also have the philosophy of holistic dentistry is a little bit different than traditional dentistry. Holistic dentistry sees the body as being connected. So really, whatever it is that you do in the patient's mouth can have an effect in the patient's body, and whatever is happening in the patient's body can have an effect on the patient's mouth. So a good example of that would be if a patient has something like a systemic disease such as diabetes. If this patient has diabetes, then you can see that diabetes in the patient's mouth. If the patient has another systemic disease such as HIV, you can see that in the patient's mouth. And the same way, the other way around, if the patient has periodontal disease, that periodontal disease can affect the patient's body also, because that periodontal disease can go to the patient's heart, they can go to the patient's connective tissue and all sorts of things. So holistic dentistry, that's what they say, is that you need to see the body as a whole. You need to see the body as connected, and then when you do something, it has an effect in all aspects of the body. So for example, I always tell my patients, you know, it's great that if your diet needs to be really good. We have Tracy McCorder here. She talks about diet. She talks about, you know, eating naturally and eating well. Your diet has to be good, but then also you need to be able to have your teeth in check also. Because if you're eating organic, if you're doing all this other stuff, you're going to the gym, you're doing yoga, but you have like a whole bunch of inflammation in your mouth, it doesn't help your overall body. So what you really want to do is you want to see your body as being like a whole system. So if you see it as being as a whole system, then what ends up happening is that you end up having like a more healthy body as you go on this journey of getting healthy. So I think that that's very important. What I'm going to do today is I'm going to go over some things that we do in holistic dentistry. We're going to go over some things, and then I think I'm going to open it up a little bit early so that you can ask me some questions. I know that you don't get a lot of opportunities to ask questions to a holistic dentist, and you know, without actually coming into the office and making an appointment and all of that. So I think I'll open it up early. If you have some questions, we can start to discuss those questions, and we could get a little bit of clarity with that. One of the first things that people always ask me about is mercury fillings. So that's one of the things with holistic dentistry is like, you know, what do you do about mercury fillings? So mercury fillings are something that were done mostly in the past. Those fillings that they call silver fillings, or those fillings that you have that are dark on your teeth, those are mercury fillings. So usually those fillings have approximately about 50 to 54% mercury. So we see mercury as having a problem with mercury, because mercury is something that can be very toxic for your body. Mercury is something that is a neurotoxin. So we see it as having no place in our patient's body, especially if you think about that mercury filling is in your mouth 24/7. It's in your mouth for years and years and years, and that mercury filling, it also emits mercury. So every time you chew on it, every time you drink something hot, every time you bite down on it, it emits mercury. So if you think over a course of, I've had patients that have had those fillings in from the 60s. So if you think about having that over a course of period of time, then what ends up happening is that you can have like a problem with mercury. Mercury can have like it can really wreak havoc on our whole body systems, because it interferes with the electrical potential of our bodies also. So that's one thing that holistic dentistry does a little bit different than traditional also. The other thing too is the way that you take out that mercury. You don't want to go to the dentist and when they take out that mercury, if we're talking about that the mercury is toxic, you don't want to just go to that dentist and they just sit you in the chair and they just grind it all out and you have all the vapors come onto you. What you want is you want to be able to take those fillings out properly. So when we do a mercury removal for from our office, the patient is fully draped. So you have draping on all your body. We give them oxygen so that they're able to breathe an alternative source, so they're not breathing in any mercury vapors. We use a special suction so that all of the vapors that come off can be sucked off the teeth, and we also really make sure that we're not just grinding out that filling. Really, you want to take that tooth out in sections. So the least amount of grinding that you do on the tooth, the better. So when we take it out in sections, and then you pull it out so that it comes out in chunks. So that you understand what I'm saying? So that there's less grinding that you do on it. So there's a lot of issues with mercury. There's a lot of talk about mercury. It's a pretty big controversy in the dental field. The American Dental Association, the FDA, and a host of other organizations say that there's nothing wrong with the mercury fillings. Just so that you know, they say there's nothing wrong with mercury fillings. Yeah, like fluoride. That there's nothing wrong with it. So, but for me personally, I see that those amalgam fillings, first of all, they're not a very good restorations. They leak all the time, they break all the time. We have much better restorations that we can do. The whole mercury and toxicity stuff aside, there's much better restorations, much better fillings that we can do today that we don't have to rely on using those mercury fillings. So all of that toxic stuff aside, they're really lousy fillings. They've been in use for the last 100 years. And I don't know what in the medical field has been in use in the last 100 years and they're still using it. So that's my philosophy on mercury fillings. The other thing that is really kind of another hot topic in holistic dentistry is the whole concept of doing root canals. So root canals, I'll show you what a root canal is. I don't draw very well, so just bear with me, okay? So if this is a tooth, right? If this is a tooth, let's say this is the tooth, this is the top of the tooth, and this is the bone, right? So the tooth sits in bone like this, right? It sits in the bone like that. What happens is with all of our teeth, we have like a canal here. So in here is like your nerves, the blood vessels, your arteries, your veins, and it connects to the rest of the body. So this is like for all teeth, right? So what a root canal does is that this canal here, they take all of that out. And the reason that they do that is if you, let's say you break this tooth, it goes in here. This is like your nerve chamber, right? So let's say you break the tooth and it goes into the nerve chamber like that. So they would take all this nerve out, all the nerve, the blood vessels, all the nutritional supply of the tooth. They'll take it out and they'll replace it. Then you replace it with like a filling material, right? So you put a filling in here. So that's what they call a root canal. So what happens is that holistic dentistry or dentistry says that, or their research has shown that this is like the main nerve trunk, right? But what happens is they also have what they call accessory canals. So there's thousands and thousands of these little canals that go in here like that, which this thing doesn't take care of, right? So thousands and thousands and thousands of these. And then what ends up happening is that you get like bacteria built up in here. And because you've now taken away the connection of the tooth to the rest of the body, because it's no longer here, your immune system can't attack that bacteria. And what happens is this bacteria gets very, very strong and it ends up coming out this way, right? And it ends up going throughout the rest of your body. So that is the issue that they have with, that is the issue that you have with root canals. What the root canal does is that it allows you to keep the tooth here though, but you end up killing what's down here. But what happens is the tooth is just like any other part of your body. It's like a living, breathing part of your body. It's just like, you know, you having your pinky here and it's broken, and the nerve, you take out the nerve supply. What your body would do is your body would want to start to try to get rid of it, because it's no longer part of the whole system. It's no longer part of your body. So that's when you start to get the gangrene. You start to, it'll eventually, actually, if it happens with your pinky, it'll start to fall off, is what would happen. The same thing starts to happen with this. A lot of these teeth end up breaking because they're just so brittle. And what happens is that they say you have to put a crown on here, to make it to protect the tooth, because it gets so brittle, because it no longer has like a nutritional supply to the rest of the body. Another part of root canal is that I'm sure you know about the Chinese system that says that you have a lot of meridians that run throughout your body. So what happens is this in Chinese medicine, this connects to a particular organ, it connects to a particular joint, it connects to a particular endocrine system, so it connects to a particular gland, so it connects to a whole lot of different parts of your body energetically. So what ends up happening is, if you are, if you're a proponent of that, what ends up happening is that now this tooth starts to affect that part of the body, if you're a proponent of that. So you really have to be, there's something to be said for Chinese medicine, and there's something to be said about the energetic things that happen in our body. So what ends up happening is then, let's say for example, these teeth over here are connected in men, they're connected to the prostate. In women, they're connected to the ovaries. So you then have to be very careful, and you have to look at that patient and see that if this patient has like a root canal here and is also having prostate cancer, is that an issue? Is that something that you might want to deal with? Or did the prostate cancer cause them to have a problem with that tooth? Or did the tooth cause the problem with the prostate cancer? So it's one of those things that if you really don't have to deal with it, we really try to get our patients to stay away from root canals, because what ends up happening is it kind of like opens a whole box of different things that could potentially happen with your tooth. So what you want to do is really stay away from it. And if you do already have a root canal, well, what do you do if you already have a root canal? You know, you can't really, I wouldn't tell somebody, let's say they had a root canal on this front tooth here. Let's say she's a 26-year-old female, attractive. I wouldn't tell them, you got to take that out and you got to put another tooth in there. I mean, that's just kind of like very traumatic. So you really kind of have to like balance that out. If she's not having any symptoms, there's no really kind of issues, then how do you do that? One of the things that we do sometimes is you can put some ozone treatment over there. Ozone is something that we use at our office. Ozone kills bacteria, it kills viruses, it kills mold, it kills just about everything, but it doesn't have a toxic effect on our bodies because of it affects the cell wall of those organisms. Our cell wall is different. So that's one of the things that you can do, is to kind of like fumigate it with some ozone, or you can just monitor it. Make sure that no symptoms develop from that. Make sure that everything is okay with that patient. But root canals are something that's pretty standard in traditional dentistry, and even sometimes in holistic dentistry. There's some holistic dentists that do root canals. They use different types of materials, but they still do root canals. So that's one of the things that you want to kind of like really be aware of when you talk about that. The other thing that happens with our office is also very it's sustainable. It's green. It's ecological. So we have all the different things from our lighting is all high efficiency lighting. The paint is no VOC paint. The flooring is all, we have like a green roof on our roof. Our ceilings are made out of recycled plastic bottles, and we do that because we want the environment that we create for our patients, we want the environment we create for our staff, we want that to be a safe environment. We want not just a safe environment for our staff, we want that a safe and really have a good relationship with the planet, so that we're not just polluting the planet. One of the things that you need to be aware of, as we talk about holistic dentistry and mercury, one of the largest sources of mercury in our city wastewater is from dental offices. So what happens is, when you take that mercury out of the patient's mouth, it usually just goes directly into the city wastewater. And then if you think that's a lot of mercury that might be coming from one office, and if you think a city has hundreds, maybe thousands of dental offices, all of that water is going into our city wastewater. So what we do at our office, and which is the sustainable green thing to do, is you have what's called an amalgam separator. And what an amalgam separator does is that it takes that amalgam that comes out of that tooth, instead of it going directly into the city wastewater, what it does is it collects it in this machine, and then when that machine is full, you have somebody come and then they take that waste and they dispose of it in a proper way. Now what happens is that waste that you have, you can't just throw that waste in the trash. You can't just throw it down the toilet or anything. You have to sign for it, because it's a toxic material. It has to, the company that you have take it away is a company that has to be certified to be able to take that stuff away. So then my question is, why is it safe when it's in your mouth, but once I take it out of your mouth, it's no longer safe, that it has to be disposed of as a toxic material? And I can't just throw it in the trash, because I'll be arrested if I try to throw it in the trash. What is the logic with you saying that, oh yeah, there's nothing wrong with mercury fillings? There's nothing wrong if it's in your mouth. But once you take it out, obviously there's a pretty big issue with it. So, you know, those are just some of the things that I want you to kind of like to be aware of. Fluoride in dentistry, we don't use a lot of, well, we don't use any fluoride at all. I don't really advocate fluoride. I think fluoride is something that is actually totally not necessary in dentistry. You know, the way that you keep your teeth clean and without cavities is you keep your teeth clean. That's how you stop cavities from happening, is you keep your teeth clean. Now, when I was in dental school, they told us cavities are caused by bacteria. Bacteria eat the food that's left on your teeth, and then when they eat the food, they eat your teeth, and then their byproducts degenerate your teeth. That's what causes cavities. You know, I don't know where fluoride comes in. You know, just clean your teeth. That's what you would have to do, is just clean your teeth. So that's another thing that we don't really give much credence to. So there's a lot of differences. There's a lot of differences between holistic dentistry and traditional dentistry. There's a lot of things that we would do that are different as far as how it is that we treat our patients, what it is that we do for our patients. We don't use any of the we don't like to use metals in the work that we do, because we see that there's no place for metals in the patient's mouth. The metals cause you like a real issue, you know. So instead of using titanium implants, we use ceramic implants. So instead of using a crown that has a whole bunch of different metals in it, we'll use a crown that is like made from zirconia, that is much more biocompatible. If you don't use the metals in your patient's mouth, the stuff that you use is much more biocompatible than the metals that you would end up using. You know, so those are some of the things that we work on really like on a daily basis. You know, I can sit up here and I can talk about holistic dentistry for a long time. I'd like to really kind of like open it up to for you to ask me some questions on some things that you have, you know, some issues that you wanna do. And I'm gonna talk a little bit about what you asked me. She asked me, actually let me talk about this now, because I have a patient here that will remain nameless. Yes. And she said that, okay, she has like a small, if I can talk about, can I tell them what our story? Yeah. So she had never had a cavity before in her life, and she was pretty distraught about having a cavity. So she had like a really small cavity. She was pretty adamant, you know, she doesn't want to get it filled. I mean, I was like, what do you mean you don't want to get it filled? She's like, I don't want that to happen in my mouth. I want you to find something else that I can do. And I was like, well, okay, let me see what else I could do. So what I did was, we have this ozone machine. I told you ozone kills all the bacteria and all that kind of stuff. And what happens is the way that decay starts is with bacteria. It's bacteria that causes the decay. So I started reading about this ozone machine, and what they said that you can do if the filling is very small, which like hers is. If it's very small, what you do is you take you can inject that ozone into the filling, maybe a couple of times, and that will kill the bacteria that's in the area for that filling. it will kill that bacteria, and that will stop the cavity process from moving forward. And then we can do the remineralizing. I found that the one without she's got me doing all this work. The one without the milk products, yeah. So I found that, the one without the milk products. So then what you do is you just keep applying it on there so that until you get some remineralization. Yeah, so we're able to do that, but it's because she has like a very, very, very small filling. I don't know how that would work on a much larger filling. I mean cavity. Yes.
Because I've tried.
I'm sorry, just like all over here.
I've stopped using like the regular.
Oh yeah.
Oh, yeah. You're just saying just to clean your teeth, but I would like to know what you recommend about cleaning your teeth with, because I've stopped using a lot of regular toothpaste with fluoride. But I tried using some with like neem, Ceramine, or different ones.
Right.
I've seen different people have different
toothpaste, right?
And I want to know what ingredients are really good.
Sure, what to stay away from. Okay, sure, we can do that. So toothpaste, right? So let me talk about toothpaste and mouth rinse. Toothpaste, what you want to stay away from, of course we said fluoride. You want to stay away from sodium lauryl sulfate. They put sodium lauryl sulfate in a lot of different things. You want to stay away from all of the sugars. And you want to, and sugars, because sometimes they kind of like sneak sugars in the toothpaste. So anything that looks like all sorbitol, all of those, those kinds of things, you want to stay away from that. And you also want to stay away from alcohols. So I don't know why, as I told you, they told us in dental school that the bacteria causes tooth decay, and the bacteria eats the sugars that's on your teeth. I don't know why you would want to have sugar in toothpaste. Why? That's just wrong. Why would you want to have why would you want to have that? So what you want to do is you want to have those things out of the toothpaste. So the things that you want is anything that's natural, anything that doesn't have any of those sugars. Usually we tell our patients, because toothpaste is not really, to be honest with you, toothpaste is not, I don't want to say it's not that important, but it's not that critical. They have you thinking that, if you don't use Colgate and, Crest, and because, now they make toothpaste is kind of like sexy, I mean, like this toothpaste, yeah. So you can even make your own toothpaste. 6 parts baking soda, 1 part sea salt. So you mix them together, add a little bit of water. You put maybe just like a drop of tea tree oil in there, and you make it into a paste. You could put it in the fridge, and you can add whatever else. Myrrh powder is also very good for your gums. So you can just do that, and I mean that works fine. That tea tree oil is more antibacterial than any Crest or any Colgate. You can add like mint or something like that to make it taste good. But really, our teeth are almost like they're self-cleansing. How they are. The bigger issue is that to clean between your teeth. So that's why flossing is so important. If you just leave your teeth and you just rinse your mouth out, you'll get all the chunks of the food out of your mouth. But what happens is that they get caught in between your teeth. So that's why the flossing is so important. So with the mouth rinse, right? With the mouth rinse, the same thing. Stay away from the alcohol, because alcohol is an astringent, right? And alcohol, it kind of like shrinks stuff up. And alcohol, as we all know, is carcinogenic. But I guess if you drink it and if it's on your tissues all the time, that's how it's not that great for you. So stay away from the alcohols, and also with that, stay away from the sugars. Okay? Great question. Can you hear that? Do you want me to repeat it? Okay. So, Corey, go ahead.
Question about root canal. If you already have root canal done, you have a crown on, and due to trauma, your other teeth could actually are problematic, but no root canal has been done at this point. Other than ozone, what else is the protocol?
So you're in the process of maybe getting a root canal?
I've had 2 done recently.
Okay.
And I've had a crown on 1. I'm waiting to have a crown on the 2nd.
Okay.
Done.
Yeah.
And there are other teeth due to trauma. It's also problematic, but it's not to the point where we need to take this out right now.
Okay. Okay.
So other than ozone, what other protocols do you use?
Yeah. We use, like I said, when I was talking about, so he's asking about root canals and alternative to root canals and stuff that you can do to prevent root canals, correct?
Well, yes.
Yeah.
I've already had 2 root canals
Yeah.
So to not have the other ones.
Yeah, get root canals. Yeah. So if you've already had root canals, then how to prevent the other ones from having root canals? I talked about the mercury and how I thought it was like a pretty lousy material to have in your mouth because it's 100 years old. There's a lot of materials that are out now that can be soothing to the nerve of the tooth. So let's say for example, like what usually happens is that if this is the tooth that we're talking about with the root canal, then what happens is that if you get like really close to the nerve of the tooth here, usually what they would say is that you would need a root canal. But what happens is that if you're able to put a material on here to kind of like soothe the nerve because you're close to the nerve, right? If you're able to do that and you leave that on there for about sometimes 6 months, sometimes for a year, what happens is that your tooth starts to kind of like come back. The nerve doesn't get as injured as much. It starts to come back, and then from there you can put you can put something on there. I've had a couple of patients that they've been to other places and said that you need a root canal, and they said they didn't want one. We did that, and it's been like a good little while now, and they haven't had any problems. Here.
What about gum bleeding?
Yeah.
Maybe some plaque. What causes plaque and how do you feel the gum bleeding?
Yeah. So the question is about gum bleeding gums. So bleeding gums is what they call in dentistry periodontal disease, and it's actually very important. Periodontal disease. Let me draw this for you. Periodontal disease is very, very important because what happens is that it's one of those things that I talked about where it really can affect the rest of your body. So what happens is that if this is your teeth, right? Let's say this is your tooth, and then you have another one over here, and then this is your teeth sit in bone like this, right? Like I said before, and then these are your gums, right? This is your gums here. So what happens with this is called periodontal disease, right? So what happens is when you eat food, usually you're able to, let's say you get like food particles here. Usually what happens is that you can get your toothbrush. This is your toothbrush. And then it gets all of this stuff out. But what happens is that if you don't clean your tooth, if you don't clean very efficiently, or if you weren't able to get everything off, some of this, which is the food particles, kind of sit around here. And what happens is the bacteria, once again, the bacteria eats that food. And then the bacteria sits on your teeth here. And it irritates your gums, right? So that is why your gums bleed, because they're irritated, right? So because you have all this buildup here from the bacteria. But even more important, this bacteria here, what it does is it travels to the rest of your body. So what they found was, if you have periodontal disease, you're 3 times likely to have heart disease. You're twice as likely to have cardiovascular disease. You're much more likely, if you add on top of that you're diabetic, it's going to cause you even more problems if you're diabetic. So what you want to do is you really want to make sure that you get that stuff off your teeth. But once it sticks on your teeth, you have to go to the dentist to get it taken off. Once you get it taken off, then your gums are no longer going to be inflamed. They're going to settle back down. They're going to stop bleeding. But you have to be able to get it off. Otherwise, what's happening is it starts to progress. And the other thing that it does is that yes, it's more than plaque, because plaque you can kind of like take off with the toothbrush or take off with your nail. This is like hard. You can't take it off. So what it does is that this bacteria here, it starts to eat this bone. So once it starts to eat this bone, instead of the bone being here, then the bone gets to be here, and then the bone gets to be here, and then you end up losing your teeth. So in this society, that's the major way people end up losing teeth in this society. If you break a tooth or if something happens with the tooth, I can more or less fix it. But if the tooth doesn't have very much support, it's a very difficult situation. I'm just going to go row by row, if you don't mind.
Right, this is related to, what about if you have receding gums?
Yeah. So about receding gums. So receding gums are similar because what happens is they're similar, but it's a little bit different. You have to find out why is it that those gums recede. So there's a number of reasons why your gums could recede. One of them is that you have like a hard toothbrush and you're brushing your tooth very hard. Even if you have a soft toothbrush and you're brushing really hard, or you're brushing your gums don't need to be brushed. So it's just make sure that you hold that toothbrush at an angle so you can get your tooth, but not necessarily the gums. The other thing that could cause that recession is the way that your teeth come together. So what happens is that all of our teeth are supposed to share the load of us coming together, of your teeth coming together. They're all supposed to come together at the same time and share the load. If you have 1, 2, 3 teeth that are hitting before some of your other teeth, it's like it's slamming on there all the time, and then what's going to happen is that it's going to recede. And you know, it's hard to find out. You'd have to get that checked to see, because the difference between a tooth hitting and not hitting is 0.5 hundredths of a millimeter. You know, so you need to check that out to see if those teeth that you have recession on, if those teeth are not are getting like really taking like a heavy load of your biting force, because that could be why is it that you're getting. You also, if you look around your tooth and you have recession too, you'll also see on an X-ray that you'll also have bone loss in that area also, because the teeth sit on top of the bone. I mean, the gums sit on top of the bone. If you have bone there, then the gums are going to stay there. If you don't have bone there, the gums are going to recede to where the bone is. You understand what I'm saying? Yeah, because they go together. The gums can't sit there by themselves. The bone is there to support them. So, you know, check and see also that you to take care of that bone loss that you have there. Next row.
Back to the root canal. What if the root canal is already done, like about over 10 years ago?
So root canal is popular today, huh?
It's already done 10 years ago. And
Yeah.
It's on the front tooth, right?
Yeah.
And is it possible? And then I think they use like rubber material to fill the.
Yeah, yeah.
Is it possible to replace the rubber material with something safer?
Yeah. Okay. So if you can replace the rubber material that they use to do the root canal with something safer, yeah, you can. There is the material that they use is called gutta percha. So gutta percha is what they put in there, right? It's kind of like an orange material. They have some materials that they say that are more biocompatible, and that picture that I showed you, they say that it seals better. Like it seals those accessory canals on the side. They say that it seals those better. So it's a possibility that you could do that. Yeah, you'd have to go to a dentist that would do that. I don't do root canals myself. You know, yeah, I hate root canals. Sorry. No, I don't do root canals. I hate them. I'm sorry. That does root canals? If you give me your information, I can check and see. I don't know really a lot of people around here that might do that, but I can check around and see. You know, I try to kind of like avoid them. yeah. But give me your information and I can check. Back there. Oh, thanks.
Thank you for coming. Our specialist here.
You came here to see me? Thank you.
I have 3 quick questions.
Sure.
One of them is, what is your policy on X-rays? Because I've had a really hard time finding a dentist in the DC area that doesn't insist on
X-rays. Yeah.
Number 2 is, I heard that BPA, which we're all trying to avoid in plastics, is actually an ingredient in composite material that we use for clinics. How do you feel about that? And the third question is, I suffer from TMJ, and I don't want to sleep with a plastic night guard in my mouth every night, because who knows what chemicals are in that. What would you recommend as a holistic treatment for TMJ?
Wow, you got some.
Thank you.
Just 3 little questions, right? Okay, so question about X-rays, TMJ, and BPA. Okay, so let me tackle X-rays first. X-rays for us are important because what happens is that I'm able to see things that I can't see without my naked eye. and it helps in the diagnosis of seeing what is it that's there. Not just it's a good service for the patient, because if you're treating, if something happens with that patient, let's say for example you don't have any x-rays and everything looks okay, but then underneath there that you might have like some God forbid you have like some issue happening there, then you've really done a disservice to the patient. So it's nice to have x-rays, and we don't take x-rays all the time. If sometimes, even if the patient has had an older x-ray, we can take a look at that just so that we kind of have like an idea that what is it that's going on there. Because medical legally also that there's an issue with that. If you're supposed to treat the patient, whether you're holistic or not, you treat them to the standard of care. And the standard of care a lot of times is that they demand that you have x-rays. So it's like you're in a tough position really, because if you don't do it, and you can get into a lot of trouble for that. But like I said, even if you take like just a couple of x-rays, you might not even have to take like a whole pan. Even if you take like, we see patients sometimes with 4 bite wings, 4 on each side. We can see, it kind of like gives you an idea of what it is that's going on. BPA, yes, those composite, when you remove the amalgam fillings, usually you replace those fillings with a composite. If it's a very large filling, what we do is we replace it with what's called an onlay. An onlay is something that, if you can imagine, the filling is sitting there, and then you take it out and now there's a hole. That hole, you take a mold of that hole and you send it to the lab, and then the lab will make you something that fits, computer generated, that fits exactly into that hole. It's not composite. It's a very hard like a ceramic type of material that you use for that. But if you're going to replace with a composite, there are composites that have BPA. But there are also composites that don't have BPA in them. They make composites that don't have BPA. The ones that we use at the office don't have BPA. It just takes a little bit of research to find out the ones that do and the ones that don't. But that's what happens with the composites. And the last one with the TMJ. The TMJ is like a, it's an issue that you have. You have like pain, yeah. Chronic pain, yeah. Well, what we found is that we do use the splint for our patients. We see a lot of patients that have the TMJ issues, and we do use the splint for them. And what they've reported is that much less pain, much less headaches. Their muscles don't feel like it's that like hard. Like in the morning it gets like really tight. So the other thing that you might want to try with TMJ is that you might want to try some cranial sacral. Have you tried that? You tried all? It works? Yeah. So you try some cranial sacral. Also, you might want to check also with the TMJs to find out why that is. Sometimes it's because you have like interferences with one of your teeth. So for example, if one of your teeth at the back, let's say you had a filling or a crown, or even had your own natural teeth, and it doesn't come together properly with your bottom teeth, then what ends up happening is that your top teeth, your other teeth, let's say it's at the top, then when your teeth come together, there's going to be a tendency for you to kind of like try to grind it down, because your teeth are not coming together. That also could cause some problems with the TMJ. And once you release that interference, then you find that the patient might get some relief. But I would say massage, the craniofacial, that, maybe even like some chiropractic type stuff, those I think would work pretty well with that. I'm gonna come to you.
Thank you. I really appreciate this session. If I asked any of these questions to my current dentist, you would just laugh and tell me it's safe.
Yeah.
So thank you.
Okay.
I wanted to ask, it looks to me like you don't take insurance. Is that true? Could you explain why you don't take insurance, what you do for people who rely on dental insurance to be able to afford these things, and what costs people can expect with usual procedures?
Okay. So the question is about insurance. So let me be clear about insurance. I think that with insurance, that I think it's great that to be able to help the patient out, because they pay a fee to the insurance company, right? And then I'm supposed to get paid from the insurance company, but it doesn't. my relationship is with me and my patient, and the relationship with the insurance company is with the patient and the insurance company, because I don't pay the premiums. So in saying all that, but we do take insurance. We do. We take, if you have a PPO, you can use it at our office. And usually for most PPOs, they reimburse whatever it is that they reimburse. We'll accept that, and then if there's then you'd be responsible for whatever's left over. But we do take PPOs, and so I've decided actually to do that because a lot of holistic dentists don't take insurance. So we can help the patients out a little bit. But let me tell you, dealing with the insurance company is a pain in the neck. I'm telling you, it's like you have to have a whole nother staff just to deal with insurance companies. It really is. It really, I'm kind of like, you know. So, but right now we do take insurance. We do take insurance. And I don't know if I mentioned, the office is located on Capitol Hill by Eastern Market. We're about 3 blocks from Eastern Market Metro is where we are. Sure. Oh, we don't take HMOs. Did I say that? Yes.
If you have actually can't remember what the plan is called, so I'll ask you later.
Okay.
But I wanted to ask about, with my teeth, my dentist told me that I have crevices in my teeth that are so deep that I can't actually clean my teeth myself.
Yeah.
And so they're in all of my molars, and she started to fix that in one part of my mouth, but she hasn't done the others. And I was wondering if you'd ever seen this, if it's common or uncommon, and what you would do to address it.
Okay. Now this is your natural teeth, right? Okay. So for me, if your natural teeth have deep grooves in them or crevices, I mean, personally, I would say, really try to keep that clean. Really try to. If they're super deep, then maybe what you can do is you could even flow some composite material in there to make it, but not to drill on it. You know what I mean? I wouldn't drill on it. I would maybe flow something in there to make it shallower as opposed to deeper. Sort of like with children where you do sealants. To flow that in there to make it shallower. But I wouldn't drill on your teeth just because you have deep, just because I wouldn't do that. I'm told that I have 5 minutes.
There's one other insurance question. The
insurance and root canals.
You actually accept taking the PPO.
Yeah.
My question is, with the protocols you use, do they accept and do they pay off on most of the things that you utilize, like the ozone and so forth?
Yeah. No, they probably wouldn't pay for ozone. If any of the treatments that we're doing, so for example, if we're doing like a filling, like you're taking out your mercury filling, and like I said, we do all of that stuff, we would just tell the insurance company we're just changing the fillings, because they don't really, it's not really necessary to let them know that we're doing all of this stuff. We're just changing one filling for another filling. So they wouldn't have no problem. If we're doing a crown, it's the same. This tooth needs a crown, this tooth needs an onlay. But stuff like ozone therapy, they wouldn't pay for that stuff. But most of the stuff that we do, the price is sort of like in there. It's not like I wouldn't charge something totally separate if I'm doing like a filling and I used ozone. I wouldn't charge like a separate ozone fee. I'm gonna charge her more because she made me do work, but everybody else would not get like a separate charge. One last question. Okay.
How much is ozone therapy? If it's done alone.
How much is what?
Ozone therapy.
The ozone. How much is the ozone therapy? Well, we usually include the ozone therapy in the work that we do. So sometimes we use it if we're doing, like, let's say we're doing an implant or something like that, or if we're doing like an extraction. It kind of like sterilizes the whole area. Most of the time when you have problems, whether you have had an extraction or implants, is because there's some bacteria in the area that starts to proliferate, and it causes you to get swollen or to get sore. So, but there's not a separate price for it. It's just something that we do to kind of like, to augment the work that we do.
I cannot just ask you the ozone thing alone, because like I just for tightening,
You can use the ozone. You can use, sometimes you're able to use it like there's like a cannula that you could use where you can breathe it. And it's actually a lot of different alternative practitioners do that, where they give you ozone, because what it does is when you inhale it, it goes throughout your system and it can kill a lot of stuff that's in there. We don't do that a lot because we just do it with the teeth. Yeah. So that is it. I'm kind of like getting the high sign that I need to cut this off. So I thank you all so very much. We're the DC Dentist, and come and see us.